Well, I think the things that cause me the most stress in caregiving are probably more the physical things, because I'm getting older too. So sometimes it's kind of hard to push the wheelchair, and it's kind of hard to get him up, and I worry about things like that, that I will have the physical strength to keep on going. Mentally, there's no problem. I'll do whatever I can do as long as I can do it. I do a lot of the research, and then I talk to him about it and see what he thinks about it. And I mean, he's the one that actually has to go through it. So when we're making decisions about research, I do use a lot of internet sources. And then we go with our heart. We had a very difficult decision to make in May. He had gone into the hospital and was not doing well, and they told us that he would have to have a very complex surgery where he would probably be in rehab for 5 or 6 months after this, or he could choose radiation. And we thought about it and researched more and more and talked to the doctors. Dr. Morgan's had a lot of input for us. Dr. Shinohara was amazing. And we decided to go with the radiation, and that was a good decision. Everyone has told us that, surgery, he probably would have been in rehab at this point still. So the radiation has been a godsend for us. If your husband is newly diagnosed with prostate cancer, again, you've got to hit the internet. You've got to be his advocate. You've got to take care of him mentally and physically. And it's not always easy. There's times when, we're both crying and upset. We had to make that decision of the surgery versus the radiation, and he was in a lot of pain at that time, and we weren't sure what was going to happen. So you've just got to, hang in there as best you can. And, as my sister always says to me, you don't have a choice. You just have to go on. And, what are you going to do? So we go on. Well, I believe that my role has changed as a caregiver for him in that it's more physical now than it used to be. Before it was mostly mental support and doing research for him. And lately, now that he's had more problems with his back and his knees and his hips and his, it's been more physical, and pushing wheelchairs when he was in the wheelchair, and helping him bathe and get dried and dressed and things like that, putting him to bed. So it has been more physical, but I still, I wouldn't give up ever being his caregiver. If your husband has advanced disease, which, Bill does now, just be aware of what's going on. And I will say this too, and may not be what anyone wants to hear, but you have got to check into the costs of treatments and your insurance plans. It's really important. Your husband's not going to want to do that, but you've got to take care of that, the financial aspect of it too. We've been told that treatments were a certain X amount of dollars, and then our insurance company was like, whoa, it was way over that. And we've ended up paying some hefty bills because of it. So I would just say watch the financial side of it too. You've got to do that.